A lot of people have asked me for their friends, what is HPV? Are they at risk for it? Should they get vaccinated? This episode is for your friends. Tell them to watch it. HPV or human papillomavirus. Hey papi. Hey papi! HPV is a virus which is spread from human to human through skin-to-skin contact, or more so, genital-to-genital contact, also known as sex. It has 100 different types and at least 14 of them can cause cancer: vaginal, penile, anal, or throat cancer, basically organs involved in sexual activity. HPV is extremely common. In fact, about 80 million Americans are infected with HPV. It's the most common sexually transmitted disease, or STD. Now, what are the symptoms of HPV infection? Oftentimes it doesn't have any symptoms. Sometimes it can cause genital warts. Usually it goes away on its own, and sometimes it can stay up to years. Remember, it's not only spread through sexual intercourse, but also skin-to-skin contact can also cause the spread of HPV. So how can we know that someone has HPV? Tough question, my friend. Should we get tested for HPV then? Well, there are tests in women that can diagnose some strains that can cause the cancer, but basically they cannot diagnose all strains of the HPV, and there's no test in men. So this makes things a little more complicated, right? The biggest risk of HPV infection is the cancers that it can cause: cancer of the throat, cancer of the penis, cancer of the vagina, or cancer of the anus. As far as testing, every woman over the age of 21 is undergoing cervical cancer screening through what is called Pap smear. Basically, it's a smear that's taken by your doctor from the cervix. Now, oftentimes they also test for HPV, and it's usually done every 3 to 5 years. Is there any treatment for HPV infection? Unfortunately not. There is no medicines that can treat HPV. Sometimes it goes away on its own, and sometimes it stays there. That's why there's a lot of people walking out there with HPV infection and they don't even know. Now, if it causes any complications like warts or cancer, then there might be some treatments for them. But for the actual infection, there is no treatment. So what can we do? This looks scary, right? People are walking around with HPV, they don't even know. We swipe right for them, we go home with them, and then the next morning we also have them. We don't know as well, and we go home with someone else in the night. Well, first off, stop swiping right and one-night stands to begin with. Secondly, there is a vaccine for it. Currently, there are 3 types of different vaccines. One type of these vaccines cover for 2 strains, one of them cover for 4 strains, and one of them cover for 9 strains of HPV. Basically, everyone between 9 years old and 26 years old would benefit from getting the vaccine. Now, if you're over 26, it does not mean that you won't benefit from getting the vaccine. Actually, FDA, the Food and Drug Administration, have approved HPV vaccine for people between 27 and 45 years old on an individual basis. So you should talk to your doctor about it. Some people might be qualified for it. People who are having their first time sex late, people who are changing partners, or people who are on immune suppressing medication. But remember, if you get the vaccine, this doesn't mean that you don't need a cancer screening for cervical cancer. Also, it's not very clear how long will you be immune. So it's a good idea to get the vaccine. It's an even greater idea to make sure you're practicing safe sex. Also, make sure you always use barrier protection, i.e. condom, because HPV vaccine might protect you against some strains of HPV, but it does not protect you against other sexually transmitted disease like HIV, chlamydia, gonorrhea, herpes, and so forth. Thank you guys for watching. If you have any questions, hit us in the comment section below. Please don't forget to share this video and subscribe to our channel. We'll be back with many more interesting medical subjects. Thanks for watching and stay healthy.